Hello everyone, I am Dr. Shrey Bhatia and I'm going to talk about hypertension. Hypertension or high blood pressure is one of the most prevalent condition in the community, so much so that around 93% of the individuals in urban cities or 27% of the individuals in the rural cities might be suffering from this condition. This condition remains undiagnosed for a long period of time. The reason is that it is essentially asymptomatic for most of the patients. But when we talk about the symptoms, few of the most common symptoms are mild headache or nosebleed or dizziness or palpitation. So palpitation means that the patient is feeling his own heartbeat. So although hypertension is a benign condition, but if it is not treated on time, it may lead to complication. Although the causative factors for hypertension, essential hypertension, is not very clear, but we are aware of certain risk factors which make an individual prone to get hypertension in future. As age advances, the chances of getting hypertension also increases. Hypertension also runs in the family, so if your parents are suffering from hypertension, chances of you getting hypertension in future is also there. Certain lifestyle related behavior like increased salt intake in the diet or high calorie intake, or individuals who are obese and overweight, or individuals who are taking alcohol regularly, who are regular smokers, these individuals are at more risk of getting hypertension than the other individuals. Since most of the patients with hypertension are asymptomatic, they do not have any symptoms, the condition remains undiagnosed for a long period of time, and diagnosis is only made when the patient is going for some other reasons to the hospital, or maybe during the community health screening or regular checkups that happen in the offices like annual health checkups or pre-employment checkups. So, and during these period, the blood pressure measurements are done, and this is the first time when you come to know that you might be having hypertension. But we cannot label a person as hypertensive by only one high blood pressure measurement. We have to measure it on the multiple occasion on a different number of days. If the patient is constantly having high blood pressure reading, then only the patient can be considered as a hypertensive patient. The diagnosis of hypertension is made by measuring blood pressure, and ideally the blood pressure measurement should be done in doctor's chamber in relaxing sitting down position in both the arms and using appropriate size of the cuff. And only one reading of high blood pressure is not enough to label a person as hypertensive, because there could be some reasons for temporary high blood pressure measurement. Maybe there is possibility that the individual is stressed, or individual is anxious, or has just done a strenuous activity. Therefore, blood pressure measurement should be done on multiple occasions, multiple times a week. And if the patient is having constantly high blood pressure measurement, then only we can label him as a hypertensive, and the treatment should be started. We consider these patients who are having stage 2 hypertension for treatment modalities. We have two ways to do it. The first and foremost step is the lifestyle modification, and the lifestyle modification includes weight control and dietary modification. So individuals who are obese and overweight must consider reduction of their weight. Individuals who are taking high salt intake in the diet, they should consider reducing the amount of salt. Therefore, it is essential that you consult a dietitian for the same. And it is also important that those who are drinking alcohol regularly, who are regular smokers, should think of or should consider quitting these two activities. Based on the severity of hypertension you are suffering with and your response to the lifestyle modification, your doctor may also prescribe to you certain antihypertensive drugs. And once this prescription has been made, it becomes very important that you take the drugs regularly on time. Also, it is important to regularly measure your blood pressure levels. You can consider buying your own BP apparatus, digital BP apparatus for home use. So hope this information has been useful to you. Thank you.
Hello everyone, I'm Akanksha Mishra, Senior Nutritionist from Tata Group team. As we all know that changing our lifestyle and controlling our diet can be helpful to control our hypertension, means high blood pressure. Today we are going to discuss how small little changes can help us to control our hypertension and weight as well. So first step what we need to follow, that we have to watch our salt intake, the direct and the indirect one as well. If we are talking about direct, it means the table salt, the direct sodium we are consuming. So first of all, we have to watch the total intake of that. It should not be more than 2 grams. Means if we are talking about in the terms of teaspoon, then it should be less than half a teaspoon in our entire day. And if we are talking about indirect way, try to consume a very less amount of ready to eat food. If you can avoid, that will be the best. In the ready to eat food, what we should avoid? Packaged food. You can check the sodium content whenever you are buying a packaged product, and you can check in the nutrition level as well. Now, next step you need to follow is that you have to work on your weight. You should not be overweight, or you should not be in the obese category if you have a family history of diabetes and hypertension, and if you are feeling any symptom of hypertension. So in that case, what you can do, first of all, try to add a lot of fiber in your diet. And if we are talking about fiber, why fiber? Fiber helps us to control our weight, as well as it also helps us to reduce the bad quality of cholesterol, and which leads to control your hypertension. So how can you add this fiber in your diet? You can add all the seasonal fruits and vegetables in your daily diet. And apart from that, you can add multigrain like ragi, bajra, jowar in your daily diet. If you want to have chapati, go for these millets. These are full of nutrients and fiber as well. Next, what you need to take care that choose healthy fat in your diet. You must be aware about the bad quality fat. Bad quality fat is one of the culprits when we are talking about hypertension and heart related problems. Try to avoid all the samosas, kachori, ready to eat snacks as I said, plus pizza, pasta, burger, french fries from the outside. If you want to enjoy these things, you can make at your home with a quality food and low healthy fats as well. For healthy fat, what you can add in your diet, you can have multiple types of nuts, which is good for your heart and which is also helpful to reduce your blood pressure. You can have almond, walnut, pistachio, different types of seeds as well. And when we are talking about oil, then we can have like the sunflower oil, canola oil, till oil, mustard oil on a rotational basis. Being physically active is one of the important points when you are trying to control your hypertension. Guidelines says that we should do at least 30 minutes of physical activity 5 days a week. In our scenario, when we are talking about a corporate lifestyle, whatever suits you. Like if you want to do Zumba, do Zumba. If you do have no time to go for the running or cycling, you can do yoga at your home. But do anything but be physically active so you can avoid all the chronic diseases like diabetes, hypertension and many more.